Good morning. My name is Madison Gittleman. I'm going to be going over my presentation of somatic symptom disorder today. Alright, our case of the day, case of Poppy. Poppy is a 12-year-old girl, the only child born to Jake and Macy Chalmers. Her parents have been happily married for 15 years. She weighed 9 pounds, 8 ounces at birth, and there were no complications during pregnancy nor childbirth. Poppy has reached all her developmental milestones while growing. The Chalmers believe in homeopathic remedies and are anti-vaxxers, so Poppy is not up to date on vaccinations. Poppy's parents have some concerns and want to get a second opinion. Poppy is complaining of severe abdominal pain, along with headaches and shortness of breath, and she complains of how tired she is all the time. Poppy has also shown signs of extreme anxiety regarding her health. Poppy's symptoms started a little over a year ago, and she has undergone numerous tests which her primary care provider has yet to find anything wrong with. Poppy has tried ginger tea and peppermint tea to help settle her stomach aches, along with different essential oils to help soothe her headaches, to no avail. Poppy is homeschooled, and her issues have started to affect her AB grades. Although she is homeschooled, she participates in extracurricular activities and is a member of clubs such as 4-H and All-Star Sports Leagues. There has been no reports of bullying of Poppy. The family life is stressed from Poppy's unresolved medical issues. So we believe our case is going to be somatic symptom disorder. Symptoms of the typical case type include mild, moderate, or severe pain, headaches, fatigue, malaise, anxiety, and excessive thoughts, feelings, and behaviors, which all our Poppy is experiencing of. Some additional symptoms is that Poppy's not up to date on her vaccines. They're doing homeopathic remedies rather than relying on the medications and evidence-based treatments. Family life is super stressed from medical issues, which don't help anything. Obviously, they just seem to make things worse when people are stressed out. The differential process, we're going to go over some other possible diagnostic considerations. She could be suffering from illness anxiety disorder, formerly known as hypochondriasis. Illness anxiety disorder is a mental health condition characterized by a preoccupation with having or acquiring a serious illness, worrying excessively that you are or may become seriously ill. Another one could be the conversion disorder. Conversion disorder is a condition where a person experiences neurological symptoms like paralysis, weakness, or sensory loss that are not explained by a medical condition. Factitious disorder. Factitious disorder is a mental health condition where a person intentionally falsifies or exaggerates physical or psychological symptoms to assume the sick role and gain attention or sympathy. Obsessive-compulsive disorder, also known as OCD. OCD is a mental health condition characterized by unwanted intrusive thoughts, obsessions, and repetitive behaviors, compulsions, that a person feels the urge to perform. Body dysmorphic disorder, also known as BDD. BDD is a mental condition characterized by extreme preoccupation with self-perceived defects in the appearance of the body, leading to distress and impairment of social and occupational functioning. And last one is the adjustment disorder. Adjustment disorder is an emotional or behavioral response to a stressful event, leading to symptoms like sadness, anxiety, and trouble functioning. So let's see here, the differential process, key arguments for the case type. Poppy is suffering severe pain in her abdominal area, along with headaches, shortness of breath, fatigue, anxiety, and malaise. Symptoms have been occurring for over a year, and there's no history of significant medical issues in Poppy or any neurological issues. key arguments for a different diagnosis. Family members are anti-vaxxers, which could lead to a number of successful illnesses. Also, the only child syndrome. She's an only child. Is she not feeling like she's getting enough attention at home from her parents or family and friends? Other ones, let's see here. Is she super worried about becoming ill? Is that making her sick? Did she have some kind of emotional or behavioral response to a stressful event that happened a year ago? That wasn't stated. We don't know. So we're going to go with our final diagnosis. Our primary diagnosis is going to be somatic symptom disorder, also known as SSD. We don't have a secondary diagnosis. Some evidence-based treatments we're going to go over for somatic symptom disorder include, but are not limited to, we have antidepressants and anxiolytics. That's going to help with some of that anxiety, relieve the anxiety. Maybe it's all anxiety-based. We're going to go with, one of the therapies is mindful-based therapy. That's just where we're going to increase awareness in the present moment. We're going to do that by meditating and using breathing exercises. We're going to, we have to observe our thoughts and feelings without negatively reacting. That's mindful-based therapy. Another therapy is the cognitive behavioral therapy. That's where we can identify and change negative thoughts and behaviors. By doing that, we have to identify, evaluate, challenge, and practice these procedures. We have to identify the negative thoughts. We have to evaluate, is it that bad? Challenge ourselves and practice that therapy. We can learn coping strategies and techniques for facing fears to change the behavior. Another therapy would be the family therapy. That's where the family's coming in. They're going to assist the family with communication and managing stress. Maybe Poppy doesn't need the homeopathic remedies. Maybe she needs to go get the vaccines to help calm her mind about certain diseases and illnesses. And that's also where we're going to promote the supportive coping for Poppy. And that just means where, we're going to go with, well, you're not dying, and we're just going to handle ourselves today. And tomorrow's going to be a new day. Tomorrow's going to be better. Let's see here. The success in treatments. What we're going to see in Poppy whenever we see success in treatments, we're going to see the improvement in the functioning, coping, and emotional well-being of everyday life. She's not going to be down in the dumps or complaining that she's hurting or, her symptoms will eventually be able to, I'm not going to say downplay, but definitely see less of, I would think. We're going to see a better participation in school and extracurriculars. She's going to get back to her AB grades. She's going to get back to the better participation. There's going to be fewer complaints and extreme thoughts, feelings, and behaviors. There's going to be fewer medical visits and tests. And there's going to be better mood regulation in Poppy. It's going to be better for her and for the whole family. Some prerequisites for the therapy, going into therapy, Poppy and her parents are going to have to come in with an open mind. They're going to have to be willing to come in and say, you know what, we can do this. This is going to help us. Kind of like manifesting, pretty much. Parents can learn to coach a child through it instead of encouraging the negative behaviors, such as, it's like, I see you, I know you're feeling bad, let's do what we can here. We're not going to encourage, oh, you poor baby, why don't you sit and rest, sort of thing. Here's here's all my references that I used. You are more than welcome to go through there and look at those whenever you have time. There are 3 peer-reviewed references in there. 2 of them I used, I think, Google. And that's all, folks. All right. Please feel free to message me through Canvas if you have any questions. I thoroughly enjoyed myself today. Thank you so much for watching, and that's it. Appreciate it.